السلام عليكم. أنا ريم من فريق Future Pathways. أولاً نشكركم على تسجيلكم وحضوركم معنا اليوم. محاضرة اليوم بعنوان Dermatology Residency in KSA بتقدمها الدكتورة لما الطويل. أنا ريم من فريق معليش. إن شاء الله محاضرة اليوم زي ما قلنا Residency of Dermatology in KSA بتقدمها الدكتورة لما الطويل. إذا عندكم أي سؤال ارسلوه على ال Q&A box بأي وقت. بنجمع الأسئلة ونسألها للدكتور نهاية المحاضرة إن شاء الله. المحاضرة تعرض لايف على يوتيوب برضو، في حال إنكم واجهتوا أي مشاكل تقدرون تتابعونا هناك، والرابط بيكون على صفحتنا بتويتر. الدكتورة ممكن تبدين؟
صباح الخير جميعاً، كيف حالكم? My name is Lama. Thank you for the introduction, Reem. I'm truly delighted to join everyone in this morning virtually to talk about dermatology in KSA, especially in Riyadh. I hope everyone's doing well and is staying safe and home. I have no conflicts of interest. This is purely for you to understand what dermatology is all about. It's not affiliated with the affiliates or the Saudi Commission for Health Specialties. In today's approach, we'll be talking about the specialty. I'll walk you through the program, a little bit of history, the insight. I know everyone likes to talk about the numbers and percentages, so I've provided some of that. And then I'll walk you through how to apply and what is the program all about, all in all. All right, so let's talk a bit about the specialty. Dermatology is basically the kind of field that deals with the hair, the skin, the nail, the visible mucous membranes. I'm pretty sure you know that by now. It talks about more than 3,000 diseases. It's constantly growing, and it's predominantly like a clinic service-based thing. All right, we have a variation in scopes of diseases. It's not always really that pretty, or you can live your life and be an A-lister. Sometimes it gets pretty rough and the patient's in an ICU setting, but thankfully that's a rarity. Dermatology offers a lot of subspecialties, so you'll deal with general, medical, pediatrics, you name it. The list is so long, and if you decide to go into one of them, you can subspecialize even further and become an expert in something further deeper into that subspecialty. All right, a bit of pros and cons. Obviously, the pros are more. So you never sleep in the hospital. If you're a person who is not into inward services, this is kind of the field for you. You're doing clinics mostly. It's predominantly regular working hours. So there are a variety of patients, all ages, both genders, great exposure. You rely on your diagnostic skills, so you're constantly improving in that regard. It is rewarding. In most instances, it's curable. If not, 80% of the time, you're halting the disease process. Patients are rarely in a life-threatening situation or setting, but they do exist. Medical and surgical options are available. So if you're the kind of person who kind of likes both, you get to have both exposures in dermatology. It offers a great opportunity for you if you're into research. So it's broad, it's constantly renewing, so great opportunities there. The cons, on the other hand, it's a lot of reading. So you're stable when you're doing the clinics, but when it comes to going back home, 80% of your time, you have to read all the new terminology and all the new diseases. Large patient loads, it's relatively a busy clinic compared to others, super competitive, that goes without saying. And of course, there are limited seats of acceptance. All right, let's talk about the program. So the Saudi Board of Dermatology was established in 1997. It's a 4-year kind of program, and it's under the supervision of the Saudi Commission for Health Specialties. Under its umbrellas, we have 4 main regions. So we have the central region, and that's my prime focus today. We have the eastern, it's a joint program. 2 cities are involved, Dammam and Al Khatif, and 3 hospitals are involved. It's joint, you're gonna rotate in all 3, and they offer relatively 6 seats per year. The western is Jeddah and Mecca. It's also a joint program. So you have 3 hospitals in Jeddah, 2 hospitals in Mecca, and you'll have to rotate in all of them. Again, the seats are around 6, give or take. And finally, in the northern, you have 3 seats, and it's the Ministry of Health and the military. So what would you look like as a resident? The resident is, as I said, is a 4-year kind of program. As an R1, you're literally an intern, but with bigger responsibility because you're not really doing dermatology. You're rotating in different subspecialties with different exposures that are relative to dermatology. There's no promotion exam during your first year. However, and there's no part, but the part is kind of optional, and usually the R1s opt for it at that given time. As an R2, through R4, you're going to do your dermatology, and this is where the setting of the clinics is going to happen, and you're going to do your on-calls, your inpatient services. Now, my program is the joint program. So what we do is in R3, we have a 3-month elective. However, if you're comparing it to the KKUH program, it's a 6-month outside elective. They do 3 mandatory months in National Guard, and then you have the 3 optional months of whatever you want. And then again, when they are in R4, they're going to do 3 months in King Faisal Specialist Hospital. From R2 through R3, this is where you have your promotional exams, and then at R4, you have your board exam. You have to pass the part in order to be promoted to a senior, the part 1. What does the consultation or the on-call service look like? On average, you're covering 1 week per month. So the way it goes, if you're in the joint program, you're going to do 4 rotations per year, 3 months each. And then within that month, you're going to do a week of on-call. And this includes an AM consultation service. And then after working hours, you're going to do a home on-call. It's usually run by the junior resident as the first on-call, and they've got your second and your third on-call services. If you're comparing this to KKUH, they usually 2 full months per year for juniors, and it's usually a consultation service mainly. So they're doing it during the working hours. The seniors is kind of different, and they usually cover 2 consecutive weeks. When it comes to vacations, it's just like any other specialty. You have your annual leave, which is 4 weeks. You have your educational leave. This is usually a week. It's kind of 5 days, but give or take. If you have an availability to include the weekend, it's a plus for you. And then you've got 1 of your 8 vacations. The other, you're probably going to be on call. So what is the program all about? If you're into in the program, it offers basic sciences, pharmacology and therapeutics, clinical diagnostic skills, derm procedures, dermatopathology, dermatosurgery, and phototherapy and laser and research. Again, I'm going to talk about research as we go further into this lecture, but the importance here is that this is part of the curriculum. So you cannot really pass R4 without having a published research during your residency. And it's not really about the examination per se, but it's the kind of exposure you want to be into and you want to like get involved into, because it is important in the field and it does contribute in the thriving of the field. We'll come to that. Training and teaching, the nature, as I mentioned, it's an outpatient kind of training session. So you're only in the clinics unless you're on call and then you have a patient in the ward and you want to discuss it with your consultant, then that's a different case. Teaching activities, you have the book reviews, derm path, journal club meetings, you can participate in research projects, and of course you have to attend your educational meetings or workshops. So you're kind of incorporating both. You're doing the curriculum and textbook kind of things, and you're going out of the book into the literature. All right, let's walk you through this. So this is the application portal. Saudi Commission for Health Specialties is the main bulk. This is where you're going to apply, and this is where you're going to be supervised, basically. And then you can decide your path. Do you want to go for the joint program, which is my program, or you want to go into the KKUH program? Either way, the end result is that you're going to take the same exam in the end. You're going to share the same curriculum with different lecture or organizational, like the organizational process is different, but like it's the same thing. But the only difference is that the KKUH program, they have their own fellowship board exam. Now, I've received questions of whether if you decide to opt for the joint program, can you do the fellowship board exam of KKUH? Technically, you can't, because from what I understood, you have to do 9 consecutive months at their hospital in order to be possibly eligible to go for the exam. But I don't think this is applicable because it's not part of the hospitals you're going to rotate in your joint pathway. So it's not really possible for you to do it. All right, so let's talk percentages. This year we had 20 nominated, 17 were accepted, 4 of them were in KKUH and 13 were in the joint program. The cumulative was 82.24. All right, so I usually would ask interns, if I have interns watching here, to take a screenshot of this, but please don't take one. This is an outdated one. I've been on the lookout for the new one. It's still not out, so please follow the Saudi Commission and take the updated dates. The bottom line from this slide is if you're an intern, this is your go-to guide on how you're gonna orient your electives, how you're gonna schedule your exams, how you're gonna do a lot of things, and it's gonna be your guide through internship, so you need this and keep a lookout at it. This, on the other hand, if I have students watching it, especially those from 3rd year and above, try to take a copy of the CV. Now, it goes without saying, the application into the program requires 3 important bulks. You have your GPA, and you have your CV, and then you have your SMLE grade. So in the CV, I usually would say, if you're a 3rd year student and above, see this year's CV and take it and try to tick off the requirements that you have. Because most probably, if it's a research project you're doing, it's not going to change in the criteria as much. So make sure that if you're a 3rd year, 4th year, 5th year, do 1 case report as a first author, do 1 research that is proper, like observational or a trial, and then do another project, which is like data collection or something. So if you do that, you're gonna have everything ready and covered by the time you're in internship, and you don't have to worry about the hassle as much. So this is one thing. The other important aspect in the CV that can be covered during your student years is to do the voluntary work. This not only shows you're into the field, but it shows, it helps you get the exposure you need. It helps you to offer to your community, because it is part of the medical umbrella as a whole. All right, and then you have your conferences. This is super important. I cannot emphasize on this as much. Even if it's not on the list, do at least one national conference. Don't go overboard and do international ones. The reason I'm saying this is you wanna, number one, see, is this the field you truly like? Do you really like the content of it, or it's just the name of it? The second important thing, it's a place for social networking, to see, to know, to be known. You wanna know who are your possible mentors in the future, who are the possible residents you're going to work with, and they also get an opportunity to meet and see you. So this is a great exposure. If you have an opportunity to participate in an oral presentation or a poster presentation, do it. This is always good, even if it's not on the CV. It's part of the thing that's going to help you with the applicational CV rather than the requirement or fulfillment CV. All right, so congratulations, now you know the process, and let's say you've matched, and this is where the interviews come in hand. Now, the interviews, we have 3 main interviews. The KKUH is a separate interview that can be done either before or after. And then you have the joint. This is where you're gonna join the program directors in one place, and you have the regional program directors, and they're just gonna interview you basically. And then we have something called the sponsorship interview. Some of the joint program centers would like to do a separate interview after the joint interview for the applicants to see if they want to sponsor them or not. This is super variable, and it depends on the year of your application and the given situation. Not every year it's done, and not every center does it every year. So the main bulk, or the main thing they rely on mostly, is going to be the joint interview. All right, so let's talk tips on how to have a smooth interview. Always pre-prep. Pre-prepping is key. The most important step is to do an elective. If you're in, let's say, 3rd, 4th, 5th year student and you know you want to do dermatology, you have your summer and you have your mandatory electives, go ahead and do dermatology. This is an advantage because it's going to give you the time to do, let's say, KKUH, and then you can do the joint program at different centers, so you can see the different exposures and you can compare and decide which one you like. And this is very important. But again, if you just decided to go for it as an intern, it doesn't matter really if you're going to do KKUH alone or the joint. It depends on the availability. No one's going to judge you if you have a valid reason for that. When it comes to the elective, I have a couple of tips on that. Just make sure ethics is very important. So you're going to be punctual. That's okay. You're going to have a great attitude. You're going to be respectful to your consultants and your residents and all of that. But one of the most important things you have to really focus on is take the initiative and show your interest. So don't just show up in time and just stay and stare. Tell them, I want to, if it's possible and they want to supervise you, for example, if you want to take on a clinic and run it under supervision, or if there's a chance to do a biopsy, do it in your 3rd and 4th year. Why not? Why have to wait until your residency or your internship? So it's a great time, and usually people are not going to offer unless you ask. So just make sure you ask, and they're really, really going to be helpful, whether it's the residents or the consultant. Everyone's really supportive. One of the very important things you have to do is when it comes to the elective, some of the centers also will have their own activities. So make sure you try to be a part of it. So if you want to present a topic or a case or something, make sure you do that. The second important thing in the prep is your CV. Content is very important. It's an application CV. It's supposed to be super simple. You're supposed to take it super easy. It's not a resume. So this is a bit off topic. I've made a supplementary content on my account. You're going to find it in a thread. You can check that out later. I'll post the account in just a bit. But be sure to make the CV concise, to the point, and helping you rather than something that they can put a lot of questions on. All right, the other important thing is the recommendation letters. Recommendation letters are very important. Don't be shy. If you do an elective and you only have an opportunity to do it only once with that given consultant, ask him for an elective, for a recommendation letter. If he is impressed by you from the first time, he's going to be supportive, or she's going to be supportive. So the worst thing you're going to get is a no. You might as well just ask for a recommendation letter. Reference letters are also okay. Personally, I didn't use a reference letter. I just stuck to my recommendation letters. The requirement is usually 3 recommendation letters, but you can go beyond. Take 5 just to be safe. And one of the most important things is practice. Practice is key. There are 4 types of questions you're going to be asked. And I'm pretty sure if you Google it, if you ask anyone from the previous years, they're going to help you and they're going to aid you through. But the most important tip here is see the questions. That's okay, but don't mimic the answers. Be yourself, okay? This is very important. The second important thing is the questions, as I said, are 4. It's either they're gonna go like, introduce yourself, and this is the best kind of question to debulk and relieve all the butterflies you're going through. And then you're gonna have the second set of questions, which is addressing the content of your CV. The third type of question is probably gonna be running around the hot topic, either regionally or internationally. So in my time, it was the Vision 2030. In this year, it's probably about COVID. next year, you never know. Just keep updated with the world. They're probably going to ask you something about it. And then the fourth question is not really up to you. It's a personality kind of question. They would either ask you or they would either observe how you interact, what your body language is, and all of that. So this is basically it. Relax. It's a fun time. You shouldn't really stress about it. It's not an exam. It doesn't really depend on your scores, so don't stress about it. If you matched, you're in. You're equally the same with all the other potential residents. So don't worry about that. Just be yourself at the day of. Be professional. Don't overdress. Don't overdress. It's very simple. All right, so this concludes my talk. I usually touch upon the international programs. However, my colleagues, Dr. Anud and Dr. Abdelhadi, are going to talk about the US and Canada program. So make sure you tune into that. They're going to be right after me. I'm pretty sure they have great contact. And then you have the French program. This is a 4-year program. It mandates French language. It's an online kind of application. They offer 3 positions per year. And then you have your German program. This is a 5-year program. Again, you need the German language, and the positions are variable from year to year. So this is pretty much it. Thank you very much for your kind attention. You have my email. Contact me anytime. You can DM me on my Twitter account. One important thing before we take on the questions is the Durham Club. This is a great opportunity for interns and students to follow, to join, to be part of, because if you're looking for a voluntary activity, they probably are going to have it. If you're looking for a research opportunity, they usually can connect you with other people. And just be involved. They do a lot of connections all over the place, a lot of announcements. So I hope you benefit from them. All right, thank you very much. Shall we do questions, Reem?
Hi, Doctor. Thank you so much. The lecture is very informative. So the first question is, what is your typical week life, daily working hours and on-calls?
It depends on the center you're rotating in. So usually we're having fixed hours. So, you know, you're working from 8 to 4. Sometimes it depends on the center. Sometimes it's from like 8 to 6, depending on the clinical load and all of that. It's not really busy. It's doable.
The second question is, هل التخصص يحتاج معدل عالي ووش المتطلبات اللي مفروض أسويها وأنا طالبة عشان أزيد فرصة قبولي؟
So this is what I was talking about initially. It doesn't. Your GPA is important. It does matter, but it's not everything. So if you can compensate when it comes to the GP with your SLE grade or your CV, your chances of going in are quite high. This is one thing. And to enhance your chances of getting in are taking the CV of this, for example, this year's applicants, they have their CV. Look at the requirement, try to fulfill it. Subconsciously, you'll be exposed to the conferences, you'll be exposed to the voluntary work, you'll be exposed to everything, and you'll be there. Just show that you're interested, and hopefully, and everything is going to be fine. So GPA is key, but it's not everything.
Okay, this third question is, do I have to take a fellowship to work as a consultant in Riyadh? If yes, what are the fellowship opportunities?
To work as a consultant, you have to do the three-year service post-graduation, and it depends on the available positions. And you do have, I'm not sure it depends really on the centers, but what I know of is you need to have the fellowship, but I'm not really sure of that.
Okay. Does the program have any surgical rotations?
You can do, yes, as I mentioned, as an R3, you have your electives. One of them is a mandatory surgical elective, and you can do it either here or you can do it abroad, wherever you want to do it. And you can explore surgery. And throughout the program itself, you are exposed to surgical procedures. They're out there. So you probably will come through some minimal surgical procedure.
Do I need to get 3 recommendations from dermatology consultants?
You need 3 recommendation letters, preferably from dermatology consultants, because that's where you're applying. I don't know if the Saudi Commission changed the requirement to more than 3, but what I know of is that you need 3.
How do we get an elective during the summer vacation, and where do you recommend it?
So again, when it comes to the electives, decide on the place you want to do your elective at, and then you would just visit the educational offices there to ask them how you applied. They probably are going to offer you an email, or they have portals in some hospitals, and you apply through the portal, and then you're going to get your response. But you have to do it ahead of time. So let's say 4 months or 3 months earlier. If you can do it earlier, that's even better.
How many researchers should be in my CV that are enough to be accepted?
If you fulfill the requirement they've offered you, you're good to go. But like but my recommendation is try to do your case report as first author, try to join an observational study, and try to do data collection. If you do all of that, then probably you're secure and well, and you're good to go. So the number, again, it depends on the CV that they've launched in that given year.
Can you please talk about the surgical dermatology?
In what sense?
I'm guessing they mean and talk a bit in depth about it.
Sure. So surgical dermatology is very broad. We have extensive kind of procedures. We can do like grafts. We can do Mohs. We can do. You can include these subspecialties of it. For example, some people decide to go for the cosmetic part of dermatosurgery. You can do. Some people would incorporate lasers under dermatosurgery, but it's really part of photobiology. But this is pretty much what it's all about.
Okay, thank you so much, Doctor. This concludes the Q&A session. Again, we'd like to thank you for taking time out of your day to give us the lecture. It's very informative. Thank you so much.
You're welcome. It's my pleasure. Have a nice day.